And as all of you are aware, there has been industrial action by doctors and nurses for the last 3 days. Behind the scenes, there is a group of professionals that work alongside the doctors and nurses. They don't work alone. And so yesterday you also saw a notice which came to fruition today of the clinical officers joining the strike. But the fact is that the hospitals are closed. So even if only the nurses and doctors are on strike, the other health professionals are not working. The hospitals are closed across the country, will bear us witness. So I'm here having been invited by the ministry with the representatives of the various associations. The Secretary General of the Kenya Clinical Officers Union is also here to go and discuss with the ministry, one, the very unfair practices that the Ministry of Health has engaged in. As we are saying, right now it is only the plight of the doctors and the nurses that is being looked at. If you look at the CBA that they signed for the doctors, it is the most discriminative CBA. But we pray that it is implemented, because if it is implemented, then it would mean all the healthcare workers must have a 300% pay rise.
I want to attach this one to the SRC that has failed in its first mandate to ensure that our workers have fair working condition and paid fairly. What I mean by this, of late we had and we know that they released a report dubbed the Job Evaluation Report, which is an odious report to us. This is an odious report because it does not address the injustices that has been happening in the health sector, more specifically the public service. When we talk about us as a clinical officer, we know that there are a number of things that has been happening that he also have took into interest. This is the salary discrepancies that people have been raising year after year, year after year. We have been following this issue for more than 5 years, raising them in different fora, but they are not addressed. So the SRC promised that they are going to do that to ensure that this salary have been harmonized, so that if you have same qualification and you are offering same services, employed by the same employer, you should be paid the same. What happened when you are employed by the parastatal and somehow you are employed by the counties? Where do we draw our pay from? It is still from the same place, but you find they are paid different. This is what we say that the SRM report ought to have addressed, but they decided to keep the status quo.